Good morning, everyone. Thank you for joining us. We're going to get started here just in a couple minutes. Give everyone enough time to log on. Good morning. For this session, Summit is proud to introduce Blue Class, a benefit solution for Oklahoma's education employees offered exclusively by Summit and Blue Cross and Blue Shield. Now, we do have the Q&A feature available today. You can submit your questions through that option, and if there's time at the end of the session, those questions will get addressed. You can also submit any questions to us via email at marketing@yoursummit.com. But I will display that email address again near the end of our session today. So let's get started. We have three guests joining us today. First is Frank Wilson. Frank is the former Executive Director of Health Choice and Senior Public Sector Consultant. Frank has over 30 years of experience managing health plans for Oklahoma's teachers and state employees. Our next panelist is Eric Wright. Eric is a senior consultant and a former vice chairman of the Health Choice Board. Eric has over 25 years experience in self-funded health plan benefits and administration, including Union Public Schools and the University of Oklahoma. Our last panelist is Todd Rolland. Todd serves as president of Summit's employee benefits practice. Having been with the company since its founding, he has tackled the most unique and complex employee benefits situations. His experience is diverse and spans multiple industries. This perspective enables him to mitigate risk and guide clients to a time-tested and creative solutions. Todd's professional designations include Certified Employee Benefits Specialist, Registered Employee Benefits Consultant, Retirement Plans Associate, and Group Benefits Associate. And with that, I will hand it off to Todd to begin today's session.
Thank you, Megan, and thank all of you for joining today. It's a real privilege to be here with you, and we're excited to share the good information that we have. A little bit about our organization. As Megan said, I'm the practice leader of our organization. And as you can see, relative to the descriptor, we're a national full service benefits firm offering solutions in the benefits, insurance, and investments landscape. We do specialize in self-funded group plans and managed benefit plans for over 1,000 employers on a national basis. We're excited today in that we have unique insight into Oklahoma's public school health plans. With Frank and Eric's background, we have an exceptional understanding and knowledge of the state laws and regulations that impact the landscape. And we look forward to sharing that with you. I would like to say that I'm not certain of a more meaningful initiative that our organization has ever been involved in from a historical perspective. The opportunity to really create an alternative, a viable alternative for our educators within the state of Oklahoma is something that we're very excited about. And frankly, with Frank's background and the lens that he's been able to see through for many years as executive director, he has some great financial metrics that are going to really rationalize and validate the concept that we're going to be talking about with you today. So I appreciate your time. And with that, Frank, I'll go ahead and turn it over to you.
Thanks, Todd. Good morning, everyone, and thank you for attending our webinar. We're very excited about this initiative. As Megan and Todd just said, I enjoyed a 32-year career with the state, specifically with Health Choice, and spent the last 11 years as the executive director of Health Choice, and 10 years prior to that, I was CFO for Health Choice as a CPA. I spent a lot of time studying the various metrics and cost trends of the major public employee sectors that participate in Health Choice, and had the opportunity to join Summit last fall. Specifically to work on this particular initiative. And a couple of things that we really want to talk about this morning, the opportunity for school districts to recognize the alternative that exists in the private sector that's also afforded in state law, which we'll get to here in a bit. But wanted to start off by giving you a little bit of background about the state plan and the different major employee sectors that participate, and really the difference in those two major employee sectors, and the opportunity that it presents, particularly for teachers. For example, something that we knew internally for many, many years, the historical costs of teachers versus state employees. And that is the fact that teachers, on average, typically have a materially lower cost per member than state employees. And it's very consistent year over year, dating all the way back to the 90s, where teachers every year significantly have lower claim costs, both for their actives as well as their retirees every year. But as you know, all of these sectors by law, at least with the state plan, are all rated the same. State law provides that they have the same benefits and the same costs, whether you're a state employee, an education employee, or even if you're a county employee or other local government like rural water district and all the other types of employee sectors that participate in the state plan. This disparity is very significant, and it's really a result of very different demographics that exist between teachers, state employees, and also very different geographic footprint that also results in very different claim costs over the years. Some of the things that we are very aware of that we believe can position school districts in a much more favorable position in terms of offering their own plan. For example, the knowledge that we have as it relates to retirees, the flexible benefit allowance, and all the various rules and regulations really position our staff at Summit, which has a great deal of experience in self-funding employee health plans, along with that combined with the fact that we have a great deal of knowledge with the state system, again, the benefit allowances, all the rules and regs, and particularly with retirees, really puts us in a good position to evaluate and develop health plans that could be much more effective for school districts. So with that, I would go to the next slide to talk about something that I think has been a bit of a mystery for many school districts over the years who have looked at the possibility of offering their own plan, and that is the state law. It's one of the things that school districts always been a little bit confused about was whether or not they continue to qualify for that state funding or that flexible benefit allowance that is provided by the state if they don't participate in the state plan. And of course, the answer to that is absolutely yes. If you look at Title 70, Section 105, a provision of the state statutes known as the Larry Dickerson Flexible Benefit Allowance Act specifically says that this funding is provided to school districts that participate either in the state plan, which you see here on the slide. It's still in statute. It calls the state plan the Oklahoma State and Education Employees Group Insurance Board. That is now a division of the Office of Management Enterprise Services, or OMES as they call it now, or school districts that provide their own plan through a self-funding arrangement. So I just want to make sure that everyone understands that the funding from the state benefit allowance provided through the Department of Education is available for all school districts that either participate in the state plan or are self-funded. We're going to talk about an example of those school districts that historically have not participated in the state plan and participate in other self-funded plans and continue to receive that flexible benefit allowance from the state. And by the way, just to provide a little bit more detail on that flexible benefit allowance will always remain equivalent to the Health Choice High Option Plan, whether you participate in the state plan or whether you offer a self-funded plan outside of the state. The funding that each teacher receives will always be equivalent to the health choice high option plan, which most of you know at this point is $615 per month. That varies or rather contrasts to the benefit allowance that state employees receive, by the way, as many of you know or may not know, in that state employees receive a significantly richer benefit allowance. Their benefit allowance has historically been higher, much higher in some cases, than the health choice high option rate. In addition, they receive 75% of their dependent premium as an allowance as well. And I thought I would also point out, many of you probably don't know, that very, very recently, Senate Bill 650 was signed into law, which also gives state employees an additional 2% increase in their state benefit allowance starting next year. Actually, it would start in 2022. This is a 2% increase, even if health choice rates were not to increase. State employees will be receiving an additional 2% increase in their benefit allowance. This is something that applies only to state employees, does not apply to teachers. So teachers are in a very different situation where they really need to find ways to maximize that monthly flexible benefit allowance and look for other opportunities to put more money in teachers' pockets to either result in take-home pay for the teacher or be able to afford a more dependent coverage and maximize that flexible benefit allowance. So next, I want to talk about the alternatives to the state plan. As we stated earlier, to continue to receive the state flexible benefit allowance, school districts must be self-funded. And while that's self-funding traditionally has worked best for those employers with 150 employers or more, it really is a fairly straightforward model. I know many school districts over the years that I have talked with have looked to explore the self-funded model and really didn't understand or were confused by how the self-funding model works. But Eric's going to talk a little bit more about that and really some of the mechanisms these days that make self-funding very straightforward and very doable for even our smaller school districts. But the alternatives to the state plan, really our objective there is to utilize the savings to increase take-home pay for teachers and make dependent, particularly early retiree coverage, more affordable, while at the same time providing a much richer benefit through the Blue Cross plans who we've been working with for several months on this. One of the other vehicles that we are exploring, as many school districts have mentioned, the possibility of a multi-school plan at the county level through interlocal agreement. I know many of you are familiar with interlocal agreements that are used for several other purchasing processes, not only through schools, but county governments. Interlocal agreement is really a fairly straightforward arrangement. I know some of you are familiar with the property and casualty interlocal agreement that many schools participate in. This is very similar, although it could be on a much smaller scale, as I said, at the county level, where the monthly county superintendent meetings really provide for a great forum for a multi-school health plan to be administered and maintained with oversight at that level. We'll talk a little bit more about that possibility here in just a bit. I would also talk just a little bit about the fact that there are several other schools that either through interlocal agreement or on their own, are providing these self-funded plans. For example, Tulsa Union, and Eric will touch on their experience here in just a bit, but they, for many, many years, have provided their own self-funded plan outside of the state, and it works very well for them. There are many other smaller schools that participate through another self-funded plan called the OPEH&W, Oklahoma Public Employees Health and Welfare Fund. Elk City is one of the larger school districts that I'm aware of that participates in that plan. It too has significantly better benefits and better rates through the private sector. And that plan has been around since the early 90s, has several counties that participate as well as smaller school districts. So moving to slide 8, I want to talk about the Blue Class offering through Summit. This is a program that we've been working with Blue Cross on for a few months now, that be offered exclusively through Summit benefits, with the goal of providing more affordable premiums in order to maximize the flexible benefit allowance for teachers, but more importantly, really give school districts, their administration, along with the collaboration with their teachers, the ability to have control over the plans, the number of plans and the plan designs, the types of plans and benefits that are offered at a local level through the individual school district, or for example, through a multi-school plan, through a county interlocal agreement. That is really the goal, is to really provide schools more flexibility to have control over the types of health plans and other benefit plans that are offered to their employees. Another goal is to significantly increase or improve the technology that is made available to the staff at school districts, particularly for many of you benefit coordinators out there. As you know, we have had many challenges over the years at the state in a one-size-fits-all plan, in being able to tailor technology in such a way that it made administration easier for you benefit coordinators that take care of all of your employees at local school districts. Some of the technology that I've seen that is available in the private sector and that will be available through this program through Blue Cross is just light years better and more advanced than what we were able to provide through the state. It really is a fantastic system that would really ease administration and integrate with all of your payrolls in order to have all of your benefits for all of your employees within one system that easily integrates with your payroll, seamless transactions of eligibility, premium accounting directly to the carrier. Just a market improvement over what I believe many of you have access through now, through the web portal that's available at Health Choice. And as much as anything, the dedicated professional team and staff that would be available from Summit to work directly with your administrations in the oversight and administration of the Blue Class health plans to your employees. This is very different, as you know, than the type of service we were able to provide at the state. I've been amazed at the level of professionalism and experience that our Summit team members have in their support of other private sector employers throughout the state. It is just night and day. The type of knowledge and professionalism that these team members have, and the type of service that they provide to the employers of our Summit clients, the detailed reporting and all the various health plan performance metrics and things like that are made available, that would be available to you guys on a periodic basis. This is a different model than what we're able to provide through the state through Health Choice and the other plans. This isn't a situation where you have folks showing up once or twice a year, if that, to hand out new rates, plan designs, and things like that. This is a much higher level of service, very high touch, where we stay in contact with you guys as the employer and meet with you regularly to go over your health plan, the cost trends, and really to look at all of the different things that are available, that are evolving in the commercial healthcare space that could be available to your employees that we simply are not able to do, again, at a one-size-fits-all plan through the state. That is not to disparage the state plan and the wonderful people that work there. It is just a very different model, one intended to be a catch-all model that by law has to provide benefits and rates that are the same for all public employees, whether they're state employees, education employees, or what have you, throughout the state. And that really limits what they're able to do at the state in terms of providing a more tailored approach to your employees' healthcare benefit needs. We don't have enough time on this webinar for me to go into detail in terms of all of the different tools and programs and strategies that are available to really improve health plans, not only for your active employees, but very much for your retirees. And that's something that I need to point out, and I probably should have pointed out earlier, is that the law does provide that if a school district provides a health plan outside of the state, they also have to provide it for their retirees. The retirees must be able to participate in that plan. Heretofore, that's been perceived as a negative, and it is really the opposite. That is really where a very significant part of this opportunity lies, and that is with being able to improve the health plan for your retirees. For example, I have many friends and family that are retirees or soon to be retirees of public school districts, but their biggest concern is that they're not able to retire when they actually become eligible. They simply can't afford the coverage. Well, there are rating strategies and other strategies that are available to us in the private sector that can potentially make that coverage much more affordable, particularly for your early retirees or retirees that are not 65 and eligible for Medicare yet. The things that we're able to do in the private sector from a rating standpoint and other programs that we're able to take advantage of, that can make a significant difference in the affordability of healthcare coverage for those retirees, both for your early pre-65s as well as Medicare eligible retirees. That is really where the big chunk of this lies. And it's an issue that is simply not able to be addressed at the state level for various reasons. There's state mandates that govern Health Choice and the other HMO plans that participate with Health Choice for the retiree coverage, that they are simply not able to have the flexibility that's needed and to work with the teacher retirement system, for example, to provide more affordable, more available coverage for your retirees. And so I definitely want to stress that. I know that can be a little bit of a surprise sometimes when school districts or administrations are looking at this particular option and they find out that they also have to provide that coverage for the retirees. And I think that causes a little bit of anxiety. Actually, it should be recognized as very much an opportunity. So I want to point that out, and if you have any questions on that, we'll be happy to get into that in more detail. But please recognize that the opportunity for the retirees is a very significant part of the Blue Class offering. With that, we go to the next slide. So at the end of the day, what we'd like to do is to be able to work with various school districts that are interested in this option. We can take a detailed look at the benefits that would be available that are comparable to what you have now through the state as a starting point, and then go from there. As I said, this is a program that is meant to be tailored specifically to your particular situation for your employees, what they would like to have in terms of plan designs, higher deductibles, lower deductibles, all those different kinds of things. We can come in with the baseline proposal that's comparable to Health Choice and then go from there. I would point out that we're looking at approximately 60 days as an effective date from the school district's decision to actually take advantage of the Blue Class offerings. And I believe on our next slide is where my colleague Eric Wright is going to talk about the self-funding model. Again, Eric has a great deal of experience in this industry with self-funding models, including with public sector entities in school districts. And Eric was also vice chairman of the Health Choice Board for many years as well. So with that, I will turn it over to Mr. Wright.
Well, thank you, Frank, and it's certainly a pleasure to be a part of this initiative today. I can't think of something, as Todd mentioned, more meaningful for us to do than help our educators in the state, particularly because this situation puts us in the advantaged position of not having to actually engage with our elected officials to do so. So it might come as a surprise to many of you on the call today to know that you're actually in a self-funded program today. Health Choice has been self-funded from the beginning. However, your experience participating in Health Choice is much more the same experience that somebody would receive in a fully insured environment where your rates are predetermined by Health Choice as well as your benefits, and then you're simply participating in the outcome of those decisions. But simply put, what is self-funding? Simply put, self-funding is the most efficient and effective way to deliver benefits to your employees. It might come as a surprise to you to know that the vast majority of American workers today, over 70% of them, participate in some type of self-funding program. So this is not a new idea or concept at all. It's been around since the early 70s. And I've worked in that industry for about 25 years, so I'm very comfortable in the space. And the great thing about self-funding is that you can customize your own benefits that are specific to the needs of your area of the country, your area that you compete for employees in, both on a retention and recruitment basis. It basically offers you complete control and flexibility over the benefits that you offer. The same authority today that Health Choice has over determining rates and benefits would pass to you if you were participating in a standalone self-funded program, or as Frank mentioned earlier, the other alternative, which is an interlocal agreement, which many of you may be familiar with because I know that a number of school districts participate in a self-funded interlocal for workers' compensation. But basically what we would do is evaluate, as Frank had mentioned, complementary. We would evaluate your claims history. We would be able to determine a set budget, and there's absolutely no risk to you beyond where we set that budget. You would pay premiums into a fund just like you do today. We would also put in place certain insurance policy coverage, which is called stop loss in our industry, that would protect the school from catastrophic claims. And the great deal is it does give you the opportunity to win at the end of the year. If your claims are below budget, then the district can either, well, you have many options, but you can certainly look at your premiums. You can either lower them, you could return those funds back to your staff. There are many, many options. And as Frank had mentioned too, looking at trying to enhance the premiums that you charge for adding dependents, or perhaps it's for early retirees when they become eligible. So in its simplest form, self-funding is a great way to manage your benefits that you offer to your workforce, as well as providing the best benefits, just like many other private sector firms do around the country, just like many public sector organizations do around the country. Next slide, please. So what we want to do is just demonstrate for our audience today that this is nothing new for schools in the state of Oklahoma, organizations that have all participated at one time in health choice. The first to really break away on their own was our higher education in the state, including the University of Oklahoma, which I've had experience in managing their plan over the years. Oklahoma State University, of course, and University of Central Oklahoma. There are some other ones out there, but those are the biggies that operate on a standalone basis. We also have an example of where our regional university systems, namely Northeastern State, East Central University, Northwestern Oklahoma State University, and many others, formed an interlocal for the purposes of offering a self-funded health plan because they felt their needs were not a one-size-fit-all like the health choice program. They wanted to have control over their benefit offering for recruitment and retention purposes, as well as having control over their benefit offerings. Union Public Schools is a great example. Really interesting. I worked with Union Public Schools for well over a decade. Their main purpose was they wanted to be the preeminent destination for the best teachers they could get their hands on in the state of Oklahoma. So it was a huge recruitment and retention effort from their administrative staff. The other thing that is unique about Union Public Schools is they truly were willing to pay more for their benefits than what they were paying through Health Choice to meet their ultimate objective. And they also wanted to be creative. They had some issues with retention of bus drivers, for example. And one of the things that they did to improve their offering is they actually put an on-site clinic. They've done some very unique things around wellness and disease management to help control their costs and also keep their employees healthier, improve lost time, all those types of things. But very creative and advanced thinking group of administrative staff at Union Public Schools, and they put together a fantastic program. The other one that sets precedent here in the state of Oklahoma is, as Frank had mentioned, the Oklahoma Public Employee Health and Welfare Plan, which has been around for a number of years. It was ostensibly focused on counties, where smaller counties could organize together and deliver a better benefit offering than what they could get on a standalone basis. They did open up their membership to schools. So there are a couple of schools that participate in this program. It's from our perspective, we think schools are very unique and also positioned extremely well to pull away from health choice should they choose to do so. And we would also encourage a standalone interlocal agreement just for schools because you're so much alike in your employee population. So next slide, please. So what we hope to encourage you to do is make a small investment to help us provide an evaluation for you. And the first thing is really just a letter that goes out to Health Choice requesting your claims information. You're entitled to receive that claims information once a year. There's no cost for that. The next thing that we would need would be your census data, which is basically just your payroll system and being able to punch out a report that demonstrates for us all the elective options that your employees have chosen. And the purpose of that beyond the medical program is we want to be able to offer like programs like life, dental, vision. It's interesting, one of the things, I'm deviating a little bit from this slide, but one of the things, Frank and I have been around the state. We visited with over 40 different schools. We've got some excellent feedback one of the things that was commonly reoccurring was that health choice is very complex once you get past the medical. There are too many vision, dental offerings, for example, and it makes it confusing on their employees. Well, we hope to simplify that. And what we want to be able to do is present to you a program that matches apples to apples with the offerings from Health Choice. So that census data with enrollment elections would be absolutely critical for us to be able to provide you an accurate evaluation. And then thirdly, our job as an independent advisor and consultant is really just to present to you in an unbiased fashion whether or not this program would work for you. I will tell you with Frank's historical information and knowledge, we know that school districts are significantly better, as he mentioned, in performance and claims costs than state workers. And so we have a really good insight into what we expect. But with that small investment, we can perform that evaluation for you. And then separately, we know that many of you may have questions. This is a complex matter for any employer, and we certainly want to encourage you to reach out to us personally. As you can see, Frank Wilson's contact information and mine as well. We're happy to come visit with you on site at your location ahead of time, and we're also open to visiting, as we have with other districts. We've participated in their county superintendent meetings, and we're happy to do whatever is most convenient and most beneficial to you. So I really personally thank you, along with our Summit executive team and the folks that are on this call with us. Appreciate your attendance today, and we look forward to visiting with you down the road. And with that, I will turn it back over to Megan.
Thank you, Eric. I'd like to thank Eric Wright, Frank Wilson, and Todd Rolland for their time in sharing this valuable information with us today. And we would like to thank all of you for joining today's session. Don't forget to connect with us on social media. We host webinars regularly on the topics of benefits, investments, and HR consulting. We are here as a resource for you. Our next webinar will be taking place on June 16th. We are excited to partner with Gable Gottwalls, Switchgear, and the Oklahoma Center for Community and Justice, where we will be discussing diversity, equity, and inclusion. And we are also excited to host an in-person seminar with CPE, SHRM, and HCRI credits this fall with some of our partners from BKD. And that session will dive deeper into the legislative and regulatory landscape for benefits. For now, thank you so much for joining us. Have a great rest of your day, and we'll see you next time.